Quality improvement. Quality improvement method is to identify and correct problems to improve outcomes by decreasing any chance of error, standardizing processes, and utilizing data-driven decision-making. For quality assurance or quality improvement, both are processes to improve quality of care and safety of the environment. However, quality improvement is proactive and process-driven. Quality assurance is reactive and problem-driven. Quality improvement process is similar to the nursing process, which has 5 steps: assessing, analyzing, planning, implementing, and evaluating. The quality improvement process steps are identifying, analyzing, developing, and testing and implementing. Standardization is creating and implementing consistent guidelines or a process or a practice. To measure quality, it can be defined in 3 various categories: in structure, process, and outcome. Structure is a condition or environment in which the care is provided. Process measures the mechanisms of care that are provided. And outcomes are measurable results, either positive or negative. The National Quality Forum is a non-for-profit organization that is dedicated to improving the quality of care and outcomes. National Quality Forum achieves this by setting standards for healthcare measurements, recommending payment and reporting of quality programs, promoting QI priorities, providing tools that measure both quality and performance, and endorsing nursing-sensitive quality indicators. Quality improvement tools are used in the improvement process to communicate information, identify problems, locate where the problems occur, assist in the decision-making process when developing a plan. An example of a tool would be a flow chart. This will classify information by visually depicting steps in a certain sequence. Another one would be a histogram. This is a bar chart that displays the distribution of continuous numerical values. This can aid in recognizing and reviewing various patterns. A run chart displays data over a specific time. These are plotted points and then connected with a visual line to help understand the trend of the data. Nursing audits are another QI tool that help measure the quality, accuracy, and development needs of clinical documentation. Nursing audits also identify errors or discrepancies in nursing documentation. Risk management is the identification, evaluation, and prioritization of risks to help eliminate or mitigate any probability or severity, and to help leverage opportunities that can protect the clients, the staffs, and the visitors from harm. Incident reports are a report of an adverse event or any event that is not consistent with the desired or normal outcome or operation. When an adverse event occurs, the nurse will document the event to provide the risk management team with an opportunity to analyze each and every detail for future quality improvement measures aimed at eliminating any risk. A sentinel event, these are patient safety events that actually reach a patient and result in death, permanent harm, or severe temporary harm and intervention to sustain life. A root cause analysis is required by the Joint Commission for all Sentinel events. National patient safety goals address client safety concerns. The Joint Commission yearly identifies goals specific to the facility type, whether it's a hospital or home care. To obtain and maintain accreditation from the Joint Commission, every facility must implement goals that have been established for their actual specific facility type. The primary focus of national patient safety goals is to reduce medical errors and increase client safety. Performance evaluations are vital to quality improvement process. Here, data is collected through evaluations to support efforts to achieve safe, quality, and cost-effective healthcare delivery that is based on specific measures or performance levels. These performance evaluations are identified by state and national agencies. Quality core measures are standardized processes and best practices designed to improve client care. The Joint Commission and the Centers for Medicare and Medicaid Services create a set of measures consistent with proven standards and recommendations to decrease any complications and ultimately to lead to better quality outcomes. There are 4 criteria that are used to identify core measures: research, proximity, accuracy, and adverse effects. Client satisfaction is a key objective of quality improvement program in healthcare. Satisfaction surveys are used in quality improvement processes to identify ways the hospital has effectively or ineffectively addressed a client problem or gaps in service from the client's actual perspective. Cost-effective care is also an objective of quality improvement. This is to protect the healthcare facility from increased care costs due to quality improvement identified risks like hospital-acquired infections. Evidence-based practice is considered a problem-solving approach to care that combines accurate scientific evidence with clinical expertise and client values. Research is utilized to determine best practices of care through the performance of studies that then will provide new knowledge or confirm what is already known about clinical practice. Combining research, evidence-based practice, and quality improvement provides a strong foundation for optimal nursing care and improved client outcomes. There are 6 steps of evidence-based practice. One is to identify a problem or ask a question. The next is to search credible sources of evidence or a literature review. The nurse will then evaluate the findings. The next step is to implement any recommendations. Then the nurse will review the effectiveness of the recommendations, and then the nurse will disseminate the knowledge that has been gained from the new clinic practice. Research in nursing practice identifies new information and ways to improve the nursing practice and find resources effectively. Nurses sometimes will conduct literature reviews to identify practice changes necessary for an identified problem, or to compare two different ways of performing a skill.